So, for my type of therapy, I chose cognitive behavioral therapy or cognitive therapy. Sometimes the behavioral is left out for some reason. And as for my disorder, I chose generalized anxiety, which that sounds like just normal anxiety if you don't know what generalized anxiety is, but it's like a more severe kind of it where it's ongoing. What is cognitive behavioral therapy? Cognitive behavioral therapy, or CBT, is a type of therapy that focuses on managing the way that you think. Works sort of like a self fulfilling prophecy in the sense that both are based on the power of belief. It works on prioritizing the helpful and beneficial ways of thinking while eliminating the negative or irrational ways. A self fulfilling prophecy is sort of when you make something real. It can be negative or positive. A negative example could be a teacher thinking that her student is a bad student and treating them like a bad student. So sooner or later, the student will be a bad student. And she made this a reality, basically. And it can also be positive, where if you really want to believe you're happier, you can literally make yourself happier. And this works sort of like that in the sense that you and your thoughts are in control of the method. And over here on the right, I got a little picture of emotions, behaviors, and thoughts and how they relate to each other in CBT. So, next we have the 5 step method. Step 1 is to make a list. Step 2 is to record your unproductive and irrational thoughts and ways of thinking. Just the way you look at stuff, really, the way you perceive the world and the things around you. So, step 3 is to make new, healthy replacement thoughts to go over these ones. Step 4 is to reflect and go through your list often, especially when you're struggling. And step 5 is to simply be aware of the negative thoughts when they occur and replace them with the better ones. Origins of CBT. So, CBT was created in the 1960s by Aaron Beck, which I didn't really know who Aaron Beck was before I started researching CBT, but he is a very prominent figure in the psychology field. He's the more I went down the rabbit hole, the more I heard of him, basically. But Aaron Beck is an American psychiatrist, now known as the father of cognitive behavioral therapy, CBT. He originally created it because he viewed many of his patients with depression had these very irrational ways of thinking. They were focused more on the negatives and couldn't see positives around them. So he created CBT to basically counter this. He passed away in 2021, unfortunately. I have a little picture of him because I thought he had a cute bow tie. Obviously, he wasn't always an old man, but I liked this one. So what is CBT effective against? It's most commonly used for anxiety and or depression. Sometimes those things go hand in hand, but that obviously makes sense because as we just went over, it was made for depression, so of course it's going to be effective against depression. But it ended up being very effective against a lot of things, like way more than I think Aaron Beck could have known when he was first brainstorming this. It's known to be effective with treating substance abuse, marital issues, eating disorders, and even severe mental illness. It could really be effective against just about anything. Obviously, every case is different, but I saw links to a lot of research articles where they were trying this with a lot of just very weird and different things, severe mental illnesses, phobias, anger issues, and obviously everyone's different and it won't work for everyone, but it's known to be effective. CBT in action. So let's say we have a patient that's focusing only on the negatives in their life. And, this could be for a variety of reasons, but for this example, we'll say maybe they lost a loved one or a pet or something like that, and they just can't seem to move on. But then when they begin to practice CBT, they can see the positives again and begin to think less on these negative, irrational thoughts until eventually these irrational thoughts are gone entirely. So, how CBT works in depth. Um, the whole point of CBT is to basically ignore and replace these irrational thoughts. And as I mentioned earlier, CBT ended up being effective against that huge variety of different things, not just depression. This is because errors in logic and judgment, so irrational thoughts, are very common in people with all sorts of psychological disorders. So now we are on to my chosen disorder. I chose generalized anxiety. I'm a very anxious person. I'm a lot better now, but that's why I chose this because I have experience with some anxiety, so I wanted to learn more about it. So, for anxiety to classify as generalized anxiety, it must be ongoing and impede daily life. So, what this means is it must occur more days than most for 6 months. And it's just being anxious over simple everyday issues. Obviously, you can be anxious over bigger issues as well, but you need to also be irrationally anxious, basically. So, my initial idea for the slide was to sort of reduce stigma and show that anyone can suffer from anxiety. Um, so, people with generalized anxiety, many famous individuals have had generalized anxiety, such as Leanne Rimes, which I didn't really know who this was, but apparently it's an actress and country singer. Abraham Lincoln, which I thought was fake at first when I read about that, but I confirmed it by multiple sources. Kristen Stewart from Twilight, and Vincent van Gogh. So you have this very diverse cast of people here. You have a singer, a president, an actress, a vampire actress, and a very famous artist. So it almost sounds like one of those jokes where a very strange group of people walk into a bar and there's a funny punchline, because that's how random these people are. And I thought that was perfect because it shows anyone can suffer from this. So, the origins of generalized anxiety. Anxiety has been with mankind for as long as anyone can really remember. The earliest recordings of the actual generalized anxiety disorder I could find were 18th century, but anxiety itself is kind of like our instincts or emotions. It's part of us. I don't think there's a person in the world, or not at least a normal person in the world, that doesn't have some anxiety. Maybe there's a condition where you can't feel it, but say for everyone else, anxiety is just part of everyday life, at least in some ways. So, as we've talked about, CBT's whole point is to counteract irrational thoughts, right? And replace them and get healthy ones. So, you have anxiety here, and anxiety as a whole stems from irrational thoughts. So, it's a match made in heaven, really, for these to work with each other. Even though he meant it for depression, I actually think it might be better for anxiety, even though both are very effective, obviously. So, why is CBT so interesting in the first place? CBT focuses on the client and empowering them to basically heal themselves. They themselves get rid of these irrational thoughts. They themselves go on this journey and through these actions to eliminate them. And I think that's very fulfilling in a way because you didn't necessarily cure yourself per se, but you did it. You fought the battles and you won the war, and that has to feel very good. I wouldn't say necessarily feel better than other therapy options, but I think having a little bit of pride in that might help you from potentially having more anxiety down the line, knowing that you yourself managed to overcome it in the first place. It's very powerful in a way.